These are the men and women preparing to head to the front line in the battle against Ebola. Army medics training at this mock field hospital in York. The pretend casualties simulate the symptoms the doctors and nurses will encounter once they're deployed to West Africa in the coming days. Today, the government announced a ramping up of the UK's military commitment to the outbreak zone. 750 military personnel are being sent to West Africa. A Navy hospital ship, the RFA Argus, will moor off the coast of Sierra Leone, and 3 Merlin helicopters will help medical staff access hard-to-reach areas of the country. The commitment to tackling Ebola at its source comes as concern mounts about its global spread. In the last hour, it's been confirmed American Thomas Duncan, who was being treated at a hospital in Texas, has died. The United States has announced it will start medical checks on travellers arriving from West Africa from this weekend.
We need people to step up now. Now is the time for action, not words. And frankly, there is not a moment to waste in this effort.
In Spain, health workers have held protests outside the Madrid hospital dealing with the first case of Ebola contracted outside Africa. Nurse Teresa Romero caught the virus caring for a priest transferred here for treatment. Phoned by a newspaper in her hospital bed, she says she feels a little bit better.
¿Estás mejor?
The health authorities here are under fire because this is where Romero was initially treated, a cordoned-off corner of her local hospital's A&E. It was more than 12 hours before she was transferred to the specialist isolation unit. Spain's Prime Minister has been forced to appeal for calm and back the approach of his country's health officials. Here in the UK, this specialist unit remains on standby, and all healthcare staff have been warned to remain vigilant. As long as the number of people infected in West Africa continues to grow, so does the risk of a case occurring here.